Doctors and medical professionals have been at the forefront of the COVID-19 fight worldwide. For this interview, we have Shanghai-based Polish Dr. Agnieszka Bielewicz with us to share her experience and perspective on China's successful fight against the pandemic and how it impacted her professional and personal life. Dr. Bielewicz is an internal medicine specialist at Parkway Health, one of China's leading international healthcare provider. Hailing from Poland, she has lived with her family in Shanghai for 8 years, raising their 3 kids. Welcome to CGT in Digital, Dr. Bielewicz.
Welcome.
What impact did COVID-19 have on your work environment, which you have partly answered? And in personal life, did you face any changes in your personal life? And as a medical professional, how do you look at the policies implemented in China that has been relatively successful in curbing the virus?
Okay, from the personal point of view, because I'm a doctor, foreigner doctor, and I don't celebrate Chinese New Year like the Chinese I used to do, I was designed to work, designated to work for the Chinese New Year, when all of my Chinese doctors, they celebrate with the family. And I was working that time, it was COVID already, and I decided to send my family out to Poland because the situation here wasn't very clear. And from this whole time, my family was in Poland, but they worry about me. They worry because they didn't know how my life looks like here. They worry about my situation, about my work. And to this extent that they call to me a few times a day to be sure that I don't have any symptoms, how is everything. And later on, anyway, we decided that my family will come back on the beginning of March. Because I told them, here is safe, here is okay. It was before the very dangerous situation, the outbreak in Europe. And they come back here, and they come back in this time that even didn't have quarantine that time, because it was only a few cases diagnosed officially in Europe. And my children generally didn't experience the full COVID lockdown nowhere in China and in Europe, because we were lucky that we chose extremely good time to come back here. Generally, we had later on, my children, they have online learning, and from my school perspective was organized perfectly because they had lessons from 9 to 3, regular lessons, including PE, music. That's why it wasn't very disturbing our normal life. Mm-hmm. As I mentioned, I have 3 children, it's quite challenging, right? But school arranged everything very well. Right. For me, the biggest issue was the summer holiday, when the first time ever during my 8 years being in China, we had to stay in China. We couldn't travel. I always travel. I'm from Poland, and for me, the most important is my family. And always I spend 2 months at least during the year with my family, with my parents, with my brother, with my sister, to let know my children their family, culture, food, explore Europe.
So in the initial stages of the coronavirus outbreak in late January, February, when China was the epicenter of the pandemic, and as you said, your family, your husband and kids, they went back to Poland. At that point in time, what kind of feedback or response were you getting from your friends and family in Poland and maybe other parts of the world? And now, what changes do you notice in their reactions once the pandemic started affecting those countries, maybe when it started affecting Poland and other parts of Europe?
That time, my family was really terrifying that I'm still working, but I'm a doctor. I cannot give up. Even when they don't have COVID, they have 1,000 different disorders, and also they required my help. But I explained them that because all of the protocols, all of the rules, and I felt even that time very safe. I was laughing that I have for the few times I have private bus because I go to work by bus with the open window without people. Generally, the situation was I felt safe. But from the European perspective, that COVID is crazy here, that the overcrowded hospitals. I sent my family photo. I was giving the interview to the Polish television to explain them that this is not that we are not dying. I'm not hungry. I show them photo from the shops that I can do the still use QID delivery. Uh, and like especially it was important to calm down my family because they will worry about me. Later on, when now how it looks now, it's very strange situation as well because my mom is nurse and everybody's asking her how is the situation with COVID in China, and my mommy, no, they don't have COVID. All of the cases in China now, almost all of the cases, they are imported one, and we don't have generally local transmission. No, this is impossible. This is possible, and this is how it is, and this is very surprising for the people because people they see China as somehow as a third world, and now when the China is dealing with these disorders, one of the not one as the best country on the world, it's difficult to believe because so many countries are so proud to say China is dealing better than we are doing. Right. And this is because like you hear in the US and Europe is exactly the same, even in my country, when the people they have to wear masks, this is against their freedom. I totally understand the idea of the freedom. However, I always try to explain your freedom finish when it doesn't affect my freedom. When you don't wear mask, you are dangerous for me. It affects my freedom, and let's respect each other. That's why even wearing the mask is the problem. Right. What it shouldn't be.
Right. So how do you think Poland and parts of Europe have handled the pandemic, particularly Poland, because that's your country? And yes, what, in your opinion, could be learned perhaps from the Chinese experience?
The current situation in Qingdao shows how it's totally different European and Chinese approach. In most of the country, like now Poland, France, Italy, Spain, they are checking mostly symptomatic cases. And if somebody is symptomatic, go home, stay home, if that it doesn't require hospitalization. And this is huge mistake. It shouldn't be like this one. It should be like in Qingdao, when I'm telling them that now in Qingdao they are going to check 9 million people, it's like, how come? Generally, most of the country, they are not doing 100 tests per day. I know the China numbers, society of the people here is totally outstanding. However, all of the approach China to fight with the COVID is totally outstanding. They don't pay for the cost. It must be done for the overall safety. And this is very ironic now when the people coming back here are foreigners and they really enjoy to being here because we are free. We would like to stay here and enjoy our freedom. But this is also create in us some kind of the survival guilty that we have good, we can go for the party, we can enjoy our life, our family, not. And this is like build dissonance in ourselves, and this is also like strange feeling. But generally, like you asked me from my medical perspective, the COVID affects people's mind deeply. Very deeply. They characters, their feelings, they worry about future. Generally, the COVID makes our life upside down in many areas. It's not only disease, it's because we didn't have anything in the past like we have COVID now, like COVID, affecting not only humans' life, humans' health. Generally, COVID affect politics, economy, each aspect of our life. Like we are laughing now that we'll have time before and after COVID. The COVID is like war. This seems to be because people are dying. We have a lot of the limitation, and our future is unknown. We don't know when it's finished, how it's finished, what will be the final, and when.
Now that China, we are also nearing the winter flu season in China, and with the Qingdao outbreak, how much shall we worry about a second wave of outbreak? Is the medical fraternity worried about it as well?
It's already proven that people with the flu, for example, and the COVID going definitely worse through these disorders. What generally everybody now with the NS fever, including flu, pneumonia, tonsillitis, is suspected for COVID. What I do at work and personally, all of my family members, we have flu vaccination, and I encourage my patients, especially with any additional disorders like the heart problems, like high blood pressure, high sugar, obese, because obesity is quite huge risk as well, to take vaccination for flu. I also suggest to take pneumococcal vaccination because it protects the lungs. And what is amazing, I was always big fan of vitamin D, because now we are looking the way how to boost our immune system. And already we know that the vitamin D is one of the vitamins which boost our immune system and makes our body stronger. However, in China, but I'm not worried too much about this Chinese outbreak because everything is so controlled. In Qingdao, we exactly know the source.
Right.
It was from the local hospital responsible for the COVID cases. It shows only that we have to pay more attention for all of those the places when the people with the COVID are observed.
We see a stark difference in perception for people who have lived in China, like you and me, for instance, who have seen how the policies have worked on the ground and how effective it has been. And for people who are outside and who are getting their information perhaps only from the slanted media narratives or media coverage of China and COVID-19, which are quite biased. So what will be your message to people outside China who fall for this, biased media reporting on China and COVID-19?
Definitely, I suggest focus on the disease. I suggest focus not to assume other people, other countries, and learn from others, learn from the others' experience. Let's see what is working and where and why. When it's working, let's copy. Like we had very good example of the New Zealand before, and Korea, Japan. It was very strict rules and it was very, very effective. In the short term, they were able to control everything. Let's give up politics. Let's not thinking about economy so much now, because if such situation will be will be lasting longer, it affects even us longer.
Yes, but is it also a silver lining about COVID-19 that actually the world is now more conscious and more aware perhaps about personal hygiene, immunity system, and more careful, and therefore would be better prepared in the future of such, if there is such an outbreak again of an unknown or known virus?
It's very difficult to say because we never ever had such disease like COVID before to this extent. And from other side, in 5, 10, 50 years, we can have another disorders which can be affecting us and spreading in totally different way. We currently know that for the COVID, those things are working because for the last few months, we had already chance to check. However, in the future, like previously we had HIV, and it also was taking very long time to find how HIV was spreading. And of course, hygiene, wearing mask, what is quite normal in Asian country, what is very unusual in Europe, it seems to be quite effective for the airborne or this kind of the spreading infection. However, it shows that we have to pay attention more for our immune system, that we have to take care about ourselves, that we have to care about our family, but also it shows that we have to be more people, to think about others, not how to be stronger, not to think only about me.
Thank you very much, Dr. Bielewicz, for sharing your professional and personal experiences in China, and particularly your experiences during the COVID-19 outbreak and how China has come out of it successfully. And thanks a lot for sharing your experience and opinions with us.
Thank you very much. You're welcome.